Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. What is rheumatoid arthritis? Rheumatoid arthritis affects your autoimmune disease. Unlike osteoarthritis, rheumatoid arthritis, RA, can affect your organs, and the symptoms can range from mild to severe. Complication number 1: bone and joint health. When you get RA, and it goes untreated, it can cause long-term health problems with your bones and joints. Joint devastation. Progressive inflamed joints from RA can destroy your cartilages and bones surrounding the joint. A severe loss of cartilage could lead to your bones becoming deformed and immobilized. When you get joint damage, it is frequently irreversible. There could be total replacement surgery like the knees, but it's not an option on most joints. ADMARD's drug, disease-modifying anti-rheumatic drugs, could prevent or delay the damaged joint. Number 2 is osteoporosis. When you are a RA sufferer, you are at increased risk of osteoporosis, which is a loss of bone density and makes fractures more probable. Osteoporosis and RA usually begin in older people and smokers. RA sufferers can have a loss of bone in the affected joints. This could be treated with corticosteroids, which are often known as anti-inflammatory steroids, which you get on prescription and are used for many uses. They come in different forms such as tablets, injections, inhalers, and even lotion or gel. Lifestyle disruption. Number 3 is how your life can be disrupted through your pains and inflammation. The following are many ways RA and the treatment can affect your lifestyle. The pain from your rheumatoid arthritis can keep you awake at night. You could also have fibromyalgia. This could disturb sleep. The nervous system causes fibromyalgia in your brain and spine, not controlling or processing pain signals from other parts of the body. Everyday tasks will become difficult with your joint damage and pain. For example, you may not do simple tasks like getting dressed or washing up, or it could just be using a mouse on your computer. The CDC, or the Centers for Disease Control and Prevention trusted source, has reported that people with RA symptoms are more likely to change jobs if they have difficulty, reduce work hours, as they are not sleeping properly and are tired all the time, retire early, they feel that they cannot manage anymore, lose their job through not being able to do the tasks, like picking up boxes in a warehouse. 4 is psychological problems. With RA, you will feel stress, anxiety, and feeling down all the time. With the pain you are in and day out. You will also feel loss of self-esteem. You may have lost your self-confidence and insecure feelings of helplessness. You will feel a lack of motivation. Clinical depression. Maybe you may feel sad all the time and could be for weeks or months rather than days. I have had depression, and it is not pleasant as I did not realize what I was crying about sometimes. I am now on pills for depression, which I will need for the rest of my life. Number 5 is anxiety disorders. Some people will find it hard to control their worries. Anxiety could be constant and often affects your daily life. The main symptoms are feeling panic, agoraphobia or claustrophobia. Could be social anxiety, called social phobia. Number 6, anemia. Anemia is where your rheumatoid arthritis inflammation can lower the production of your red blood cells produced in your body, and this could be caused by fatigue, weakness, dizziness. 7 is lungs. Rheumatoid arthritis can affect your lungs, called rheumatoid lung, a group of lung conditions. These can include pleural effusion. This is where you get fluid in the lungs or your chest cavity. Pulmonary fibrosis. This one is thickening or scarring of your tissues. The structure of your lungs stiffens and less effectively sends oxygen to the bloodstream. Therefore, the stiffness of the tissues in your lungs will be more difficult to increase the lungs and breathe. Nodules is number 8. The nodules or lumps of tissue is described as a growth of irregular tissues that develop just under the skin. The nodules can also be found deeper than the skin tissues like your internal organs. 9 Pulmonary hypertension. Changes in your pulmonary arteries cause the blood vessels to carry the blood from your heart to the lungs, which can cause heart disease. The inflammation could go in or around your heart, which causes myocarditis and pericarditis. Myocarditis, this is inflammation of the muscles of the heart. Pericarditis is the inflamed membrane that covers your heart. Both are very dangerous as they can lead to CHF or congestive heart failure. Because the heart can't pump blood adequately around the body, fluid collects in the lungs. This means that people with ARA can also have an increased risk of heart attack, hardening of the arteries or blood vessel inflammation. Number 10. Sjögren's syndrome. Rheumatoid arthritis is also linked with Sjögren's syndrome. Sjögren's syndrome is an autoimmune condition that attacks moisture product cells, like tear glands. This syndrome is mainly in women, and its symptoms are dry eyes and mouth, increase of cavities in your teeth. If you are a woman, you may get dryness in the vaginal area. You may have difficulty swallowing and talking. Conclusion: it's essential to get treatment for RA as soon as possible. The earlier you can get treatment, the better. Good care could increase your probability of remission, and it can reduce joint damage and the experience of inflammation. Work closely with your physical and occupational therapy and your GP to help you with a plan that will work for you or your child. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.